Hi! Today I would like to demonstrate and perform a Swedish back massage. We're going to learn 4 techniques: Effleurage, Petrissage, friction, and tapotement. To begin the actual work on a person, what I like to do first is I like to take a deep breath and then exhale down into my feet and feel the soles of my feet connecting to the ground. And after I am calm inside, then I place my hands on the person that I'm going to be working on. I could start with a little bit of rocking. It's soothing to the nervous system to be rocked, just for a little while. And then I would start with the actual back massage. A wonderful beginning stroke for the back is a Effleurage stroke, going up the back, over the shoulders, turning the hands a little bit, and coming up through the pelvis. And we start again, stroking up the back, next to the spine, all the way to the neck, over the shoulders, turning our hands, and then coming over the pelvis together. Flowing up the back, in the middle, coming all the way to the neck, over the shoulders, turning the hands, coming down over the pelvis, and bringing your hands together. And now, Effleurage stroke number 2. Taking both hands, putting them next to each other, stroking up the back, over the shoulder, and straight back down, all the way to the hips, and starting over again. On one side of the back. Then to get to the other side, letting my hands come up in the middle, coming down in the middle, and now I'm going to turn around and do the same thing on the other side. And finishing up with the beginning stroke. Both hands next to the spine, hands over the shoulder, drawing my hands back, coming over the pelvis, and again up the back, over the shoulders, down on the sides of the back, and coming back together. And now, Effleurage stroke number 3. I'm pulling my hands across the person's back, all the way from one side of the back to the other. This is a slow, deep, flowing move. And one hand stops at the neck. I'll glide down and start all over again. It's a wave-like motion. And gliding back down. Effleurage in French means stroking. So the 3 strokes you just saw are the stroking Effleurage strokes in the Swedish technique. Now we're going to move on to the Petrissage technique of Swedish, and that means kneading or milking the tissue. What I do is I use my hands to grasp the skin and muscle tissue and squeeze it every time I grasp. The technique is that my hand goes from a C hold to a V. My fingers are straight and not curled. This avoids bruising the tissue. So I'm grasping with straight fingers in a C motion the tissue and squeeze it between my thumb and fingers. In alternating motions with my hands. I pick up the skin tissue here and squeeze it again and again. This allows circulation to come into the muscles and the skin. It feels especially good up here on the neck. Picking up and squeezing the skin tissue and muscle tissue underneath. And when I have arrived at the neck area, I'll glide down back to the pelvis and begin again. Always watching my hands so that the fingers are straight and my fingers are in a C motion and then turning into a V. And I cover the whole back, the whole side of the back with this stroke. I leave no inch undone. When we are working on the back, one thing we need to be aware of, and that is the spine. And the spine is in the middle of the back. We never want to put pressure on the spine. We always work on one side or the other next to the spine. So now we're going to the friction part of Swedish massage. And we're going to go across the fibers of the muscles. Friction works deeply into the muscle tissue. And I am aware of the spine right here. And then I use my fingers to push across the muscle fibers of the spinal muscle. You can even see the muscle here pop out. And we take our fingers and deeply stroke across this muscle. Very often, a lot of tension is anywhere along this long muscle that goes all the way from the pelvis to the neck. When I come to the neck, I glide back down and I do this again. This is slow and deeply done. Following it all the way, always finding the spot next to the spine to start, going from the spine outward, stroking deeply through these muscles with my fingertips. That feels wonderful. Another approach to the friction segment of Swedish massage is to work with our whole hand and the heel of our hand. And this time we're going to work on our side of the back. So we begin placing our hand straight next to the spine. We're going to work with the heel of our hand, and it will look like this. Deeply going across the same muscle that we were working on the other side, using the heel of our hand, moving upwards from right next to the spine, out over the main muscles of the back, erector spinae muscles, and slowly and deeply working up towards the shoulders And when we arrive in the shoulder area, we're going to use the other hand to complete that side of the back. Always using the heel of our hand from the spine outward towards the shoulders. Up in this area there are many tension bundles. There's a lot of tension stored from our life and work on computers, driving, and stress of life altogether. So we can spend some time here working through and smoothing out these muscles. The other hand rests on the back just for support and warmth. Okay, so this was the second approach to the friction. And then there is one more. This stroke is done with the fingers. And we use our fingertips in circular motion from the spine, next to the spine, out, over the main back muscles that run right next to the spine. Circular motion, deep into the tissue with our fingertips like this, making a circle, circling up, across the fibers of this muscle, circular motion, up and up further. Up towards the neck, into the neck muscles, upper back, base of neck, and then gliding down and starting it again. This time, second time, we can move a little faster. The heel of the hand should also be resting on the back. And then I would do the same thing on the other side. The last stroke of the Swedish back massage, in terms of technique, is tapotement. And tapotement is stimulating to the nervous system. And one of the techniques is cupping. It looks and sounds like this. It should sound hollow. There is another technique as well, and it is hacking. Looks like this. And what we do with our hands is we let our fingers fall onto each other. And it's only done with the fingers, not with the side of the hand. So the fingers are loosely slapping onto each other, and it sounds like this. And we can do this really all over the body. We could go down the legs and come up the other leg. And the faster we do it lightly, the more stimulating it is to the nervous system. So this is a good technique to bring a person out of a relaxing massage. You can add one more tapotement stroke. It's called beating. It sounds cruel, but it feels actually pretty good. And letting your fists fall loosely onto the back, bouncing off with your fists. This is great after a cold, when there's mucus stored in the lungs, or for cystic fibrosis. beating the rib cage, beating the upper area of the back, coming across to the other side. It will stimulate mucus secretion in the lungs. Okay, and to end the whole back massage, we finish with the Effleurage stroke that we started with. Starting in the middle, low back, stroking up with our fingertips towards the head, to the neck, over the shoulders, turning our hands and coming back down on the sides towards the middle of the low back. And then placing our hands on the back and rocking the person a little bit. She's taking a deep breath and I'm taking a deep breath. And that will make every back very happy.